We're just going to summarize some of the key points of the lecture. And just to reiterate, the tutorial is designed for educational purposes only. The tutorial is not designed as a diagnostic or to treat anyone or to make any recommendations that learners deploy any knowledge or techniques as part of a treatment plan. So it's purely for educational purposes only. So first of all, let's explore fear. Well, fear is short-term. It's an emotional state triggered. It's immediate danger or harmful stimulus. So that, for example, could be a wild dog is chasing you, if someone with a weapon was walking towards you, if you saw a dangerous spider or a spider you consider dangerous. So there'd be a short-term emotional state that's triggered. Now, when we think of anxiety, anxiety is an uncomfortable emotional state which continues and is triggered by anticipation. So we anticipate or imagination of danger or dangerous stimulus, and that could be internal or external. Irrespective of either or, the response is the same. The biological response is the same, whether it's fear or whether it's anxiety. So there's the biological mechanism is the same. Now, the diagnostic criteria for anxiety disorders, as set out in the DSM-5 and the ICD-11, the classification systems for diagnostic guidelines, anxiety and fear-related disorders. We'll briefly discuss that. So the ICD-10 is an international undertaking written by the World Health Organization, WHO, and it classifies not just mental disorders, but all recognized diseases and medical conditions. The DSM is the Diagnostic and Statistical Manual of Disorders. It's used by clinicians and mental health professionals such as psychiatrists to diagnose psychiatric illnesses. The DSM is published by the American Psychiatric Association and covers all categories of mental health disorders for both adults and children. The DSM is utilized widely in the United States, for example, and also it's used in Europe and the UK as well, around the world, for psychiatric diagnosis, for treatment recommendations, and for insurance coverage purposes. So clinicians utilize the DSM, the Diagnostic and Statistical Manual of Mental Health Disorders, published by the American Psychiatric Association, to determine whether a set of symptoms or behavior meets the criteria for diagnosis as a psychological disorder. The International Classification of Diseases, published by the WHO, is also frequently used too, more so in Europe. So the DSM-5 outlines specific criteria to help professionals diagnose anxiety. So we'll sort of briefly look at that. So the DSM-4 category of anxiety disorders became 3 separate categories in the DSM-5. So the categories of anxiety disorders became 3 separate categories in DSM-5, and they are category 1, anxiety disorders, such as separation anxiety disorder, selective mutism, specific phobia, social phobia, panic disorders, agoraphobia, and generalized anxiety disorders. Category 2, obsessive compulsive disorders, so obsessive compulsive disorder, body dysmorphic disorder, hoarding disorder, trichomoludria, and excoriation disorders. Category 3, trauma and stress-related disorders, such as reactive attachment disorder, disinhibited social engagement disorder, PTSD, acute stress disorder, and adjustment disorder. So different types of anxieties, for example, separation anxiety, social phobia, social anxiety, OCD, agoraphobia, PTSD, post-traumatic stress disorder, panic disorders, GAD disorder as well, the different types. So what generally happens is a mental health professional, an appropriate mental health professional, will do an assessment. And during that assessment, the clinician will use, as we've discussed, the diagnostic criteria, standardized assessments, and a clinical judgment to make a diagnosis. Now, in the UK, you've got the NICE guidelines, NICE guidelines, and they recommend the following for systematic assessment of anxiety disorders. to consider the specificity, the severity, and degree of functional impairment of the disorder. There are also specific scales for measuring anxiety as well. So the NICE guidelines, the National Institute for Clinical Excellence in the UK, makes evidence-based recommendations for anxiety disorders. One point of consideration, obviously, anxiety can be sort of mistaken as well for other conditions, and including physical health conditions. There can be an overlap. So, obviously I'm not a medical health professional, but it's worth taking into consideration that anxiety can be mistaken. For example, it could be peptic ulcer disease, sleep apnea syndrome, Frester stress, Cushing syndrome, thyroid dysfunction, hyperthyroidism, vitamin deficiencies, substance, medication-induced neurological conditions, depression, asthma, caffeine, other disorders as well. It could be mistaken for brain tumor, stroke, dementia, epilepsy, cerebral vascular disease, traumatic brain injury as well. So that's one sort of point of consideration. Certainly, in my own experience, I work with people who've got performance anxiety, sub-threshold anxiety, so they've got some of the constructs, but they haven't been diagnosed as such per se, or could be related to performance, say doing a presentation, say a sporting event. So the constructs can be debilitating to a point, but they may not be diagnosed by an appropriate mental health professional. So that obviously informs what we do. But equally, all things said and done, I do recommend that, certainly even in the case of performance anxiety, someone comes along, this suggests, okay, well, maybe they do want to see a GP, just to be safe, just to be sure, because obviously it's not my field, to make sure there's nothing else that they may take into consideration, obviously, which can be treated, obviously will be treated from that perspective. So that's just something to sort of think about in terms of anxiety as such. So for me, it's always important to sort of, have that sort of biopsychosocial approach. And in my own sort of personal career, a lot of people I work with that are anxiety related, generally sort of performance anxiety. So they've got a big presentation coming up, they've got a sporting event coming up, they've got, say, it's performance related. So they don't generally meet that sort of construct that a mental health professional would give that sort of diagnosis, but it can be also debilitating. So debilitation might be they don't do the presentation, they don't do the interview, they struggle with the sporting event. So it can be debilitating. But even in such occasions, I think it's still worth, exploring, just to be on the safe side, that there's sort of nothing else that needs to be explored from a biological perspective. So that's pretty much in a nutshell. In our next sort of tutorial, we'll go into in a bit more detail in terms of anxiety and obviously how it affects people.